pain in the face, headache, facial paralysis, loss of balance while walking. Initially, the family thought this was a psychiatric illness. Then they thought it was black magic. Until finally, the patient lost consciousness and was taken to the hospital, where an MRI was performed and a large CPangle tumor was discovered. Today, let us discover what this tumor is all about.
So today we are operating on a very large brain tumor. This is unusually large brain tumor. And if you can zoom here, you can see this white portion, which is a massive brain tumor, which is pressing brain. Actually, this part is called a brainstem on this side. This darker part is getting pushed on this side by this tumor. And you can see how extensive this tumor is. And this patient is a young man, huge tumor. And this tumor is also extending. If you focus here, this is what is called as coronal section. This is extending in another compartment of brain also, which is the temporal fossa. So not only it is present down here, pressing the brainstem, starting right from the spinal cord brainstem junction, occupying the entire portion of the cerebellar space called as posterior fossa on one side, and then spilling on to the compartment where cerebrum is located, as you can see here. It is spilling here also. So certainly it is one of the largest brain tumors that we have operated till now in our brain tumor center.
This young man had a very large epidermoid tumor in an area of the brain called the cerebellopontine angle or CPangle. This area is near important nerves that control the sensation of the face, the movement of the face, the hearing, as well as balance. Also, this area has nerves which control swallowing and speech. In this particular person, the tumor had grown so large that it extended upward into another part of the brain called the supratentorial fossa, which is the part occupied by the large part of the brain called the cerebrum. The epidermoid cyst that he had was not a cancer. It was a slow-growing, benign growth that usually develops from skin cells which are trapped inside the brain during early development before birth. These tumors grow very slowly, but over time, they can become large and press on the nearby nerves and brain structures. This patient came to our hospital with several serious symptoms. The most painful problem was severe trigeminal neuralgia. This means that the patient had very strong, sudden facial pain which was caused by the pressure on the trigeminal nerve because of the tumor. This nerve controls feeling in the face. The patient also had severe headaches because the cyst was increasing the pressure inside the skull. In addition, the patient had trouble with balance and walking, which we call ataxia. This happened because the tumor was pressing on parts of the brain that control coordination. The patient also had slight facial paralysis on the left side of the face. This was because the facial nerve, which controls the movement, was being affected by the tumor. The MRI of this person is what we have in front of us now, and this shows the very large epidermoid tumor in the CPangle that had spread into the supratentorial area from below. Because this cyst was causing several serious symptoms and compressing important nerves, surgery was needed, it was urgent, and this was how the patient was counseled. The goal of this surgery was to remove as much of the tumor as possible and relieve pressure on the nerves and the part of the brain which controls coordination and balance. Since this tumor had spread into two compartments, the goal of the surgery was to deal with the most serious symptoms first, that is, dealing with the CPangle first, and then, probably in a second stage, to go for the supratentorial tumor excision. Removal of these tumors can be difficult because they often are stuck very closely to the nerves and blood vessels. At our center, we are very careful to avoid damaging these structures. We use several nerve monitoring as well as other modern techniques, including using a very powerful neurosurgical microscope as well as endoscopes to be able to visualize each and every structure before they are removed. After surgery, the patient's pain and headaches improved. Balance became better over time. Facial weakness also resolved over the next 1 month after surgery. The point of showing this MRI today was to show how a slow growing epidermoid tumor can become very large and cause severe symptoms. Early diagnosis and careful surgical management are important to reduce pain, improve function, as well as to protect important brain nerves and most importantly, to preserve life. If you are interested in knowing more about CPangle and the tumors that can be present in the CPangle, do watch this video to get more information.